Hi, I'm Cheryl Salman, and we still have our two guests. We've got Dr. Janani Sivanathan as well as Zandria Oy, and we're going to take some questions from Zandria's followers regarding your reproductive health. And of course, there's no other better person to ask than Dr. Janani. I'd like to know about fertility and PCOS, especially around 35 years old.
PCOS can affect fertility, as mentioned, because the ovaries lining is too thick, so the ovum cannot come out or burst out of the ovary, and so ovulation doesn't occur, and that is why you get irregular periods, because the ovum is not passing through. So it does affect fertility.
I'm just really curious, sorry, but how do you know that you have PCOS?
So if you have irregular periods, so that's one of the things. That means like maybe you only have periods once every 4 months, 6 months, really irregular, and features of hyperandrogenism. That means the male hormones are more. Then you would get facial hair, male balding pattern. The body type also differs in the women. So it's bigger on the top and smaller at the bottom, compared to the pear shape that normally women would have.
And this is in combination, everything. So not just a standalone symptom.
Yes, so there have to be a few criteria to be fulfilled to say the patient has PCOS.
I never knew any of this.
I never knew it too. Can I conceive naturally?
Of course you can. So if a patient has been diagnosed with PCOS, the first important thing is a healthy lifestyle, diet and exercise to lose weight, and this will regulate the cycles and they can conceive naturally.
Is it true that PCOS makes you fat?
It is a possible link, because PCOS is not only about the female reproductive system, it also entails metabolic syndrome, where the person is more prone to develop diabetes, high blood pressure, and heart problems. So that is why it's important not only for the fertility part and reproductive, because it has long-term consequences. And why does a person become fat is because of insulin resistance in the body.
Is it a must to remove polycystic cysts, or can it go away on its own?
Like mentioned before, in PCOS, it is not exactly cysts per se. We don't need to remove the cysts because they are actually very small follicles. However, if you're planning for a pregnancy and, like I said, the ovum cannot come out from that thickened surface of the ovary, so sometimes what we do is a laparoscopic procedure and burn the surface so that the ovum can escape.
Okay. Is it true that only diet and exercise can solve PCOS?
Well, that is one of the major contributing factors to PCOS treatment. Diet and exercise to reverse the hormonal issues and the PCOS.
But also then you also have a healthier lifestyle.
Of course.
Yeah, that's the...
And then you get your ideal weight, and then you can conceive.
So yes,
okay.
Yes.
Thank you, Dr. Janani. Thank you, Zandria. If you found this video on PCOS helpful, there's a previous video on endometriosis that will be helpful for you too.